Yeah, there's a number of ways that it's changed. And what I want to also highlight is it wasn't just COVID, right? We've seen drastic changes. Think of really it was only in early 2000s that we started doing things with our EHRs more robustly. And we always say in nursing, if it's not documented, it isn't done. So just having that EHR and the technology in the background there has sort of changed the flow of emergency department operations. Of course, Affordable Care Act, we saw a little bit more influx in just emergency room visits and people having a little bit better access to care. And then, as you mentioned, the pandemic that changed everything. So, although we were having holding and ER overcrowding pre 2020, what we have seen post the pandemic and post 2020 is just everything kind of on steroids. It's been an exponential growth. So, patients are more and more seeking out care in emergency departments for primary care type visits, so lower acuity. I'll use our ESI scale a lot for reference. If you're not familiar, an ESI 1 or 2 would be a life threatening, threat to life or limb kind of triage score. And then those lower acuities we would say are 4 or 5. Certainly need to be seen, but not a life threatening acuity. So, again, just to highlight the last 10 years, we've really seen an increase in those lower acuity visits to the emergency departments. And then subsequently, we see this huge bottleneck of patients just not being able to get out of the emergency department to their inpatient stay. So, after a patient is worked up in the emergency department, if the disposition is determined by the provider to say, hey, this patient needs overnight stay, needs to be cared for in the hospital and be admitted to the hospital, we find we wind up with what we call ER holds. So the patients that are technically admitted on paper to, the upstairs ICU, to the med surge floor, whatever the case might be, but they're sort of stuck in the ER because there's no room at the inn, as we like to say. The patients are just stuck staying in the emergency department, which then, as you can imagine, backs everything up. So the question has become, how can we care for our patients who are still coming in? The ER doesn't close its doors. We're still getting that influx of patients in the front door, but yet we can't get our patients to their final disposition, which might be the ICU or might be, an inpatient stay. So you wind up with this huge overcrowding. And that's I don't want to say it's just the pandemic, right? I think it's a number of factors, but it has certainly been the trend over the year after year after year. We're just getting huge influx of patients and essentially nowhere to put them. So that's been, I think, the greatest challenge for caregivers inside the emergency department. And of course, it creates a barrier to access for care if patients are coming in any one of those numbers, whether they're really acute or really not so acute. It just takes longer before they get into the department to see providers.